Look at people like Rahm Emanuel. He understands that. He's working with Senator Barkers. He's, day and night in the Congress doing these kinds of things. And I think that my sense is, in the end, that they're going to get this ball across the goal line. But it's a long drive ahead of them. But they know they have to score here.
And Mary, is the risk for Republicans that they think that model will work? That they think just let the Democrats go, let them do this, and we can go to the 1994 model? Is that risky for your party? Could they be relying maybe on old school thinking?
Well, they're not. That's not the option. That's what Obama is trying to make us think is the option, that they are presenting no alternative, or as Governor or Secretary Sebelius said this morning, the status quo. They're not presenting the status quo. They're presenting what Susan Collins talked about, targeting chronic cost drivers like diabetes, getting home health care, pooling insurance. There's a lot of Republican programs that increase competition, which reduces cost and improves quality. There's plans out there. That's what they're doing. They're not counting on the Democrats just destroying themselves. And many of the Democrats are not going to let Obama destroy them. Our own Democratic senator here, Mary Landrieu, said there will be no vote from her for a public option. The Democrats you had on this morning did not sound like they were for the public option. Rahm Emanuel knows that. James is 100% right. They can walk and chew gum, and you have to do that when you're in the White House. But no, there's no poll that shows that Americans want to completely have the government take over health care before they deal with the existing problems.
I'm old enough, unfortunately or fortunately, to remember that was what we heard. We had Medicare, that this was going to be socialism. This is the government take over health care. Well, the Republicans tried to cut Medicare. That didn't work out too good for them. And what you have here, if you have a public option, that's hardly the government taking over health care. This is the same argument that we always hear.
John.
This is something that we've got to, Go ahead, I'm sorry.
Go ahead. I just want to say this.
Quickly.
Medicare funding is going to run out in 8 years, James. 8 years. It costs 15 times more than its original estimates. That's what will happen with this. We can't afford it. It won't improve quality. It will dismantle private insurance. It will eliminate options. It is government-run health care.
All right, let's close on a different subject. Let me call time out and close on a different subject.